Oh, hey guys, it's Bearded Merce. What am I doing? I'm about to do a blood transfusion. Come along with me as we do a blood transfusion together. So guys, we're going to go over today blood transfusions. We're going to talk about pediatric patients, adult patients. We're going to talk about when to transfuse, and then we're also going to show you hands-on how to prime and administer the blood transfusion. So the first thing is for stable patients, we're not going to transfuse usually unless the hemoglobin is less than 7. And then we're going to go over the special considerations for pediatric patients, 40 kilograms and less. Right now, we're going to start off with our above 40 kilogram patients, or our adult patients, and we're going to start with our documentation. So when you guys get the order to transfuse blood, it's going to look like this. So you want to make sure that you have your type-in screen done. You're going to have verified consents, and then it's going to be blood bank to prepare PRBCs 2 units, and then it's going to be a nursing order to transfuse. After that, so you get your order, you're going to come up to here on the top. So sometimes the blood transfusion might be up in the top. If it's not, and you see these 3 dots, it might be down here. If you don't see it down here, it might also be down and rarely used. Okay? So we're going to go over here. We're going to go to blood transfusion. The first thing that you have to do is you have to make sure that you release the blood. So you'll see this order here, and it says transfusion, 0 of 2 released. So the first thing you need to do is you need to hit this release button. Once you hit this, and now it says 1 of 2 released. So you have now released the blood to the blood bank, notifying them that they need to prepare 1 unit of blood for you. Okay? After that, when you're waiting, so you're going to want to go into forms fast. So forms fast is... Where is my forms fast? Do I not have it on here? So your forms fast should be over here. And if it's not over here, check up here. So forms fast. Unfortunately, in the sandbox, I can't launch it. But what you're going to do is you're going to print off this transfusion component request form. So on this form, you need to make sure that you put your ID number, the ordering provider, the diagnosis, the date, the time, and our location. After you have done that, you will put what blood product you are requesting. All right. A patient label comes up in this top corner here, and then you are going to take this down to the blood bank, and they will give you your blood. Now, when do you know when to take that down? The blood bank should call you and let you know that that blood is ready. Okay. Once they do that, you take this form, you get your cooler, and you want to make sure that everything is ready to go. Because once you receive that blood, you have 30 minutes to hang the blood. If you cannot hang that blood within the 30 minutes, you need to make sure that you call blood bank and that you return the blood back to them until you are ready. So next, now you have released your blood. You're waiting for the blood to get ready from the blood bank. You can start your pre-transfusion documentation. Now, with that being said, you want to make sure that this is not done more than 30 minutes before the transfusion. Vital signs must be done within the half hour of your start time. Okay? So you're going to start here, pre-medication. So if you don't have any pre-medication, this would be where it brings up your MAR. There's nothing that you have to do. So you can go back to the blood transfusion narrator. Next is pre-vital signs. So here, you're going to go in and you're going to put in your pre-transfusion vitals. So 120 on 80, temp is 98F, heart rate is 100, respiratory are 18, oxygen is 100%. And then you want to make sure that you do a respiratory assessment. So you want to make sure, is it within normal limits, exceptions. Then you're going to scroll down and you're going to do your pre-documentation. So did you give any pre-meds? So if you are giving oral pre-medications, you want to administer those 30 to 60 minutes before your transfusion. If you are giving IV medications, you want to make sure that they are given 15 minutes prior, okay? So we did not give any pre-meds, so we're going to say no. So do they have the consent? So either you need to make sure that you verify that you saw the provider sign the consents, or make sure that they're scanned into the chart under media. So we saw them scan it, and we are not using a blood warmer. After that, you're going to go down, you get your blood, and we will show you later on how to actually prime your line and transfuse your blood. But the next step would be to start your transfusion on the narrator. So you would click here, you go down to start transfusion. Transfusion is going to bring up this screen. You're going to come over here, you're going to click on rate. Once you click on the rate, you're going to hit this little syringe button, and then that's going to populate this screen. And our blood, and then there you go. So signed blood consents, yes. Blood band matches, yes. Yes. Blood type on bag matches tag, yes. Unit number on blood matches, yes. And special blood considerations, yes, because most of your blood will be leuko-reduced. Now make sure that you read it to see if it is leuko-reduced. You will then hit accept. Again, because we don't have it linked to a patient, it will not let us actually administer it. So you do not do this. You scan everything, but we just have to kind of go around it. So this is where it'll give you the flag to do your double nurse cosign. So this is where you'll cosign. So now we had our cosign. It says our rate here. You're going to pick your start time. So you can do now. And then you're going to let this go for your 15 minutes. So after 15 minutes, you're going to let this, you're going to stay with your patient. You're going to go back to your blood transfusion narrator. And then after 15 minutes, you're going to click your 15-minute vitals. So here you're going to type in your 15-minute vitals. Then you hit close. So you have to then go back in to your transfusion. So you're going to click back into the start. And now, since it's been 15 minutes, we are going to click this again. And you shouldn't have to scan any of the blood. All you're going to do is you're going to click rate dose change. So rate dose change. And you're going to click it to a standard 200 mLs. All right. And then you can do use all previous values. And then you hit accept. So then you're going to select your time. You're going to hit now. And you're going to put here volume infused. So you can, ours is only going to be 16, but it should be a little bit more. You use the calculator for the time. Hit accept. And then suspected reaction. So did this patient have a reaction? So what are some things that we're looking for as our reaction? So it's going to be a fever, itching, hives, shortness of breath, changes in mental status. All right. If you have any of those, you're going to stop the infusion immediately, and you're going to notify the provider and call the blood bank. All right. So we are going to say that our patient didn't have any adverse effects, so we're going to hit no. So at this point, we can walk out of the room and finish our blood transfusion. When our blood transfusion has finished, we are going to go back into the narrator. So blood transfusion narrator. And we're going to hit stop and complete transfusion. So once you hit this, you are going to add a new column. It should come up, but because we are doing it, add column. And then what you're going to do is you're going to click on here for your rate, and you're going to click stopped. All right? You're going to use all previous, accept. So once you did that, it'll automatically calculate your volume. You hit accept and complete. So now your blood is completed. So once you do that, you go back into your blood transfusion. You're going to go to your post vitals. You're going to place your post vitals again. You're going to do a respiratory assessment again as well. And then you're going to hit close. So now what you're going to do is you're going to go back. And if you look up here, it should tell you that it was completed. So if you look right under here, this right here says that it was completed. So we know at our first bag of blood on 11/12/25 at 14:57 was completed. And the total volume that was infused was 22.67 mLs. All right. Now, again, when you guys do this, it's going to be a lot more. It should be around 300 to 350, okay? But make sure that you verify on the blood bag how much blood is in that bag and that it matches this volume, okay? Now, we have one more bag to infuse. So we go back and we start that process all over again with the release button, all right? You go through everything the same way. All right, guys, since we just went over documentation for adult patients, we're going to go over some pediatric considerations. Now, the documentation is going to be all the same, but you have to just calculate the volume a little bit differently, okay? So for packed red blood cells, it's going to be 10 to 15 mLs per kilogram, and that's going to be your total volume to infuse. You're going to infuse the first 15 minutes is going to be 5% of the total volume, or a max of 15 mLs, whichever one is less. You need to make sure that when you prime the line, that you prime it all the way to the end with blood. And then our vital time checks are going to be a little bit different. So you're going to check vital signs every 15 minutes, 2 times, then every 30 minutes, 1 time, then every hour until the infusion is complete. The nurse is only required to stay in the room for that first 15-minute vital check, and then make sure when you stop the infusion that the total volume infused might be a little different than what's on the bag. There may be some blood left over, so you have to make sure that you look at your order for how many mLs to transfuse, okay? I will give you an example of how to calculate this on the screen, okay? So the example I have for you guys today, it's going to be a 2-year-old female weighing 25 pounds. Needs a transfusion of packed red cells over 4 hours. So you have to take that 25 pounds divided by 2.2 to get your 11.4 kilos. After that, what you're going to do is you're going to do 11.4 times 10, which equals 114 mLs total volume of red blood cells. All right. After that, we're going to try to calculate our first 15-minute transfusion. And so that's going to be 114 mLs times 5%, which equals 5.7 mLs. And you're going to infuse that over 15 minutes. So we need to program the pump at a rate of 22.8 mLs per hour. In 15 minutes, we'll check our vitals, and then we'll reprogram our pump for 108.3 mLs, because we're going to take that 5.7, subtract it from the 114, and that's what's going to be the left over. And the volume to be infused is going to be 3 hours and 45 minutes because we've already given our first 15. So the new rate will be 28.9 mLs per hour. And don't forget, we need to do our vitals 15 minutes after that. Then we are going to do a 30-minute vital. And then we are going to do a vital every hour until the infusion is completed.